You have another tool that's available now that people can go in and do their own tests on a website. Can you talk a little bit about that?
Sure. Cancer Care Ontario launched, it's called My Cancer IQ. So it's a takeoff on IQ, and it's a website, and it patients can go if they're not so comfortable on the computer with a daughter or a family member, and you answer. It's all confidential, but it'll give you a report if you like, and you can enter in. It'll ask you many questions about what we just talked about: your family history, your personal history, your habits, these kind of things, and through proven algorithms, you can type in your information and it'll tell you if you're at low risk, average, or perhaps high risk for, I believe it's up to 6 different cancers. We started with breast, colorectal, and cervical, and now we're on to skin cancers, melanomas, kidney cancer, and one more that escapes me, lung cancer. So it's a useful tool in that I've done it with patients where I've got a smoker, and we go through it and look at their risk for lung cancer, and it comes up high. And then we adjust for cutting back the cigarettes or stopping in a certain length of time, and you can show to them in hard facts that this is a significant risk for you, and maybe you should consider some action. The My Cancer IQ will lead patients towards those sites. It doesn't alarm patients, this My Cancer IQ, and it's a good tool for people to start thinking about their risk for cancer and what they might be able to do themselves, or what program they might want to start doing at different ages. Canadian Cancer Society has a similar tool called It's My Life. I've not had a chance to do that myself, but I believe it would be a similar thing for patients sort of to understand their risks and decide, yes, I'd like more information and I really want to know about this. It's also led for me with 2 patients where they've identified that they're at high risk for certain cancers, is there are other sites ask for much more information, but can give much more precise risks, and you can really prove to a person how critical a change could be in their life by 30 minutes of exercise 5 days a week. It doesn't have to be onerous, and if you can work that into your life schedule somehow, by changing very little, you can lower your risks substantially.
What successes have you seen since the promotion of screening for cancer?
Well, again, back to the breast cancer, there's been a significant decrease in mortality. It's very hard on studies to differentiate where that mortality benefit came from, but certainly a significant part is from detection of earlier cancers. If we look at the stage at which breast cancer is diagnosed back in the mid-'80s when I started practice, over half women that were treated with breast cancer in Ontario in those days had disease advanced to the nodes. Now that figure is much less than 20%. So we've moved the stage of diagnosis of breast cancer dramatically to earlier stage disease. Colorectal screening programs, the data is not quite out yet in Ontario, but I suspect in the next year or 2 we'll start to see data showing that not only have patients been found with earlier cancers and treated, but a number of patients have been found to have polyps. And they've had those treated and they will never develop the cancer. So the cancer screening in colon is acting in a way as a cancer prevention program. Improvement, cervical cancer, the death rates have dropped every year since cervical screenings have been more widespread. So we've seen improvements in that area. We may see things down the road in lung cancer screening. That's a whole another interesting topic that you're going to hear a lot more about over the next couple of years. But lung cancer in general is an area that has seen some breakthroughs in chemotherapies for some lung cancers, but in general, the outlook has remained grim for that cancer, and perhaps that will change with screening down the road.
And pancreatic cancer.
Yeah, so if you look at mortality from any cancer we know,
Yes.
it's been at the bottom, and it's been at the bottom forever. Occasionally, I've never seen it, I don't think, you'll find a patient where the pancreatic cancer is found by mistake. Say they're having some other procedure or a scan and they see a little mass in the pancreas. And those patients can undergo a rigorous operation, and some will survive. But mortality rates, I believe, for pancreatic cancers are probably 95% over 10 years. So there has not been a whole lot of development. We have a researcher here in Kingston, Dr. Jim Biaggi, who works at the Canadian Clinical Trials Group in our Southeast Regional Cancer Program. He's doing research right now on a type of chemotherapy for some pancreatic cancer patients, I believe with assistance from the Canadian Cancer Society. So we've got researchers like Jim and others around trying to crack this. And I'm not a cancer researcher, so it's above my head, but we may see results from his study, I believe, in a couple of years that may show some progress. The trouble with pancreatic cancer is there is no, it's an uncommon cancer, so to take everybody over 50 and do an ultrasound or some kind of test doesn't make sense. There's no screening test, there's no blood test to find it when it's early. And it's not that common of a cancer, so a cancer screening for it is unlikely to be the answer. It's likely at the other end that hopefully once it's found, there may be some new chemotherapeutic agent or a new immunotherapy agent that are now becoming common, or genetic mutation therapy, these kind of things may be the answer down the road.
If you could sum up, make a final statement about screening for cancer.
I'd be trying to go after the 30% of people that just can't bring themselves to do it. And say, speak to your family doctor or your nurse practitioner, ask them what cancer screening is advised for them, ask all the questions, ask why, ask what the benefits are, what the risks are, and really try to understand it and face it and come to a conclusion. If you decide after all that information that it's not for you, that's fine. But I wouldn't want someone to make an uninformed decision, not go for cancer screening, and then have a poor outcome down the road for something that may have been detected at a much earlier stage. So that would be the message I'd give to people.
Thank you very much for joining us today, Dr. Langley.
Thanks, April.